everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week we have new perspectives, we have people in new specialties, and a lot of great information and a lot of lessons to be learned. And so today I have a really awesome special guest for you, someone that is really fun, really exciting. I know has a lot to tell me today. Want to welcome Dr. Toby Lingafelter, owner of Dr. Toby's Place in St. Louis. Dr. Toby, welcome.
Thank you so much, Rachel. It's very, very exciting to be here.
Yeah, I'm super stoked to hear all your interesting insights about what you do and what got you here. But that's kind of how I want to start out. I love the origin story. I love, hearing about, what prompted all of this. What got you excited about opening a private practice and what got you here?
Well, as many of us know, you grow up and you get jobs and you meet people and you meet a lot of people that are in charge of you that shouldn't be there. I'm sure we can all relate to that story. So along the way, somewhere I said, at some point I need to work for myself. And I was in a former life before the doctor of chiropractic stuff. I was a golf professional. I was a teaching professional, and I really enjoyed that. And really learned how to work with people and different personalities and all that stuff. And so when I got into private practice as a chiropractor, it really wasn't that hard for me. It was just a different language I was speaking and a different schema, if you will, of relating to people. And here we are 20 years later and still doing the same thing, not playing as much golf as I'd like to, but that's okay. When you have twins in college, it's hard to do that.
Definitely. And to tee up our next question, I had to throw in the dad joke there. Would also love to hear about, the areas that you're treating. What are people today you find are really struggling with?
That's a great question because when I first got into practice 20 years ago, it was at least where I'm at in the country. I'm in St. Louis, Missouri, smack dab in the middle of the heartland here. It was 75, 80% all low back pain. It was, people still had labor jobs. They were
Yep.
still, techs and digging ditches and working outside and whatever. And then these things took over, these things we're talking on right now, and these god awful things, these phones, and it's completely flipped. I'm 80% upper back, neck, shoulders, carpal tunnel, elbows,
Really?
overuse. I had a young lady in here yesterday that she's a social media. That's what she's been doing. She's young and her right thumb is trashed and she's from just too much this stuff. So yeah, it's been interesting to see it all play out.
Yeah, it must have been interesting to kind of see the evolution of, what kind of jobs everyone has and how that really does affect us in our everyday, those repetitive motions, those things that we're doing this,
Yes,
you know,
all day long and at
all
home all night long.
all night long.
All
Yeah,
night
and
long.
yeah, I can definitely see that that is definitely a trigger point for people and what is, definitely popular in terms of the pain points of what we're seeing today. Um, would love to know about, how your approach is different. Obviously, you have a really interesting background with the golf pro and, getting into what you're doing now. How does that all combine and how you treat a person?
Well, it's interesting because I had this discussion the other day with a friend of mine. I go, if I'd have known what I know now about human biomechanics and the way the body works 25 years ago or 30 years ago when I was doing the golf thing, I may still be there. It is, but the approach I take is I'm not, I'm not curing cancer over here. I'm taking care of musculoskeletal issues, overuse things, uh, back pain, neck pain, people get in car accidents. They need our care. And first and foremost, as a chiropractor, I find, and it doesn't matter if it's your finger, thumb, wrist, elbow, spine, ankle, hip, when joints lose the ability to move and go through their full range of motion, they begin to basically die, and that's what starts the arthritic process that emerges later in life. So, if you couple mobilizing joints with, I'm also, I think we talked about this last week. I'm a SoftWave provider, the tissue regeneration therapy. I've had the device for just under 2 years now, and it's been a game changer for a lot of things that I would normally have to refer out to my orthopedic friends. That I mean, I can't regenerate tissue. I can't fix a ligament with an adjustment. Can't do it. It's not going to happen. But this device makes me keep more of those people in house and be able to give them the results that they want.
I kind of want to double tap into SoftWave. I think it's
Yay!
such a cool technology. Can you tell us what it is, but also what are you using it for? What do you think has been really successful about it?
Great question. Well, in 2 years, I've treated some of the. So it works the best and fastest on knees and feet.
Oh,
So we don't know why. It just does. So if you got somebody's got arthritic knee, even somebody that's already had a knee replacement and they're having some residual inflammatory things, you can use it on that. I've done that. Plantar fasciitis. I've got a lady I'm treating at a colleague's office. It's mobile, which is a good thing. I can take it around. I'm treating
cool.
her neuroma. Now, it's not going to make the neuroma go away, but it's going to make the inflammatory response around that neuroma that's a pain causer to be modulated and not have to go in there and dig around in your foot and cut the darn thing out, which is a whole nother set of whatever problems you can run into. We've treated a lot of shoulders, carpal tunnel, golfer's elbow, tennis elbow. There's even a protocol that we've developed for treating sinuses. Like in St. Louis here, we live in the allergy armpit of America.
Yes, you
And
do.
everybody has, I do some clinical nutrition stuff with some lab testing. And of the 500, 700, 800, whatever it is, people I've lab tested in the last half a dozen years, every single person in this town has a low grade infection of some sort. And it has to be due to the allergy. We're in between two
Wild.
rivers. We got all, yeah, it's crazy. But that helps. It's not going to make the thing go away, but you're not going to wake up every morning, with your eyes shut and your nose, you can't, breathe. So it's great for that kind of stuff.
That's
Yeah,
fantastic. That
it's unbelievable.
no one has talked about that. I mean, I think there's a subset of people that know about SoftWave or a little bit loosely of the technology that's there, but had no idea that it's wonderful for feet.
Yeah, it's great.
I mean, that's, shoulders, knees, I would maybe expect
Uh,
that, right? But really cool, really fascinating. I love that. And also in terms of technology that's out there, for better or for worse, we're in 2025, right? And so people are using Google, ChatGPT, all sorts of ways to find out information about their health online, which it's nice to know that people have taken an interest in their health. Go you, right? But
yeah.
sometimes it's not the best. Sometimes you read things, maybe aging myself, it was WebMD and you had an ache and a pain and then you have stage 4 cancer. It's just not true.
Right.
Right. So there's a lot of misconceptions in
Yeah.
healthcare. You can go from A
Yeah.
to Z very quickly. So
Really, very quickly.
very, very quickly. So what would you say are some of the misconceptions that you are debunking, maybe on a semi-regular basis? What are some common questions that you get and you're like, man,
That
that's
is
so
that is
not
the
true.
greatest question ever been asked, by the way. Thank you, Rachel. The greatest
Wow.
question ever been asked. So what I've seen in 20 years, and it's so everybody exactly what you just said, because of Dr. Google,
Mhm.
um, everybody thinks they're going to die tomorrow when they have an ache or pain.
Yeah.
Um, the thing that just it's not I don't want to say irritates me, but it confounds me, the fact that there's a certain subset of the population that thinks that they're not allowed to have problems. Why does my back hurt? Well, because you've been sitting behind your computer for 8 hours and you never got up and moved around. Interviewing cool people like me. You got to get up and move around, right?
Yep.
My favorite thing is the overuse, the overdiagnosis of the system. Well, here's a perfect example. Here in the Missouri, it's like, let's say we'll call it worker compensation, the protocols. Like if you get hurt, or you work at a construction company and you lift too many 2x4s and you twist your back. Well, here's what the way the system's set up in this state anyway, is that like the employer chooses where you go,
Yeah.
right?
Yep.
And so oftentimes they'll send them to one of these doc in the box emergency rooms, or if it's bad enough, they'll send them to the hospital. Well, they're gonna just it's just simple. I lifted and twisted and hurt my back. They're going to run a UA. They're going to draw blood. They're going to take X-rays. They're going to do a CT. They're going to do MR. And $15,000 later, they send you home with painkillers and muscle relaxers.
Mm.
And then the dude comes into my office next week, and we treat him 3 or 4 times. He's fine. And it's the overdiagnosis of everything, and then the overuse of just for run of the mill stuff. Um, there, okay, so and then there's a certain sect, SECT, of
Mhm.
chiropractor physicians in the country that love to overtreat.
Mm.
So I get these a lot too. 20-year-old kid picked up a 2x4. He's a cub carpenter.
Yep.
Strained his back, goes to this chiropractor. They said, "Oh, you got to pay me $5,000 and come in 87 times." No, you don't. No,
Mm.
no, you don't. And so it's that's the misconception. People say,
Yeah.
once you start coming to the chiropractor, you have to come out. No, no, you don't. Depending on who you are, what you do, what your history, what your lifestyle is. I have some people I see 4 times a year. I see some people I see 4 times a month, just because of where they're at.
Sure.
You know? If
Yeah.
you can avoid getting surgical intervention, and one of my best friends is an orthopedic surgeon, so we talk about this stuff all the time. And if you can avoid getting cut on for any reason, you're going to have a better opportunity to
Yeah.
don't have replacements parts
Yeah.
as you get older.
Yeah. Not so much the bionic human.
Right, right.
Yeah.
And
No.
that's a whole nother conversation we can have later.
Oh,
So
I'm
it's different
sure.
time.
I mean, listen, it's there. It can be great for so many people, right? Or else we wouldn't be here. But in other ways, some of it, how you're saying, some things are just overprescribed. Maybe it's you're in an acute situation and they're going to, ABC to the, Z plan of what you should be doing with your health, and that may not also be the right fit for you when you're kind of in that A B stage of your injury journey.
Right. 100%. I have people, it just happened this week. A young man was referred to me as a roofer, and
Mm.
he's in pretty bad shape, but he's probably been I've been doing this a long time. He's probably been in pretty bad shape for a while. And so, you start treatment, then sometimes they get worse before they get better. So I'm like, go get something from your medical person to settle this down
Yeah.
so I can get in there and do my job easier. It's less
Yeah.
painful for you. And then we'll get you through there. Sometimes you got to just, throw something in there to calm it down. And that's
Yeah.
great. We have the system we have, but it's the problem is that sometimes they throw stuff in there to calm it down, and then they never keep on going to fix the problem.
Yeah. They
Therein lies the
see a
issue.
little relief and then they're like,
Yeah.
oh, I
Oh, I'm fine.
delay it and then
Yeah.
screaming in the middle of the night.
Exactly. Exactly.
Yep, 100%. I love that. Would love to kind of round out today. You've given us such great things to chew on and think about, and I just kind of want to dive in a little bit more to getting some advice. There are a lot of people out there today that are not only, patients, but other practitioners as well. A lot of what we do is obviously helping private practices excel, and I think with great people that come on our Spotlight program, it's such a great way to share pro tips for both people. And so we love to ask, one, what is a great pro tip for anyone that wants to improve their health? What is like one way that they can take their health in a positive direction today? And then what is one way for a practitioner to take their practice in a positive way? What is something that maybe you do on a daily basis that you're like, yeah, I have to do this for my practice every day, whether it's something I do for my patients or piece of technology that I have. What are the pro tips for everybody?
Oh gosh, yeah. The first pro tip, um, this is America, and I think it might be the worldwide, is dietary. And I had this revelation 5 or 6 years ago. I'm like, I could be the greatest chiropractor that's magic hands, that ever lived, but people are so unhealthy on the inside that it really doesn't matter because it's just going to keep coming back. Nobody eats enough protein, and that's the bottom line. And it's hard to do. Like at my age, I'm supposed to be consuming over 100 and some grams of protein a day. I do weight training twice a week, and so it's hard to do. It's really hard to do.
Mhm.
But it's like, I don't do politics, but if Mr. Kennedy does half the things he says he wants to do, it's going to be so much better because
Yep.
he at least acknowledges it's a problem, right? You
Mhm.
know, it's people stop drinking soda. I'm sorry, I don't care if it's diet, cut it out. It's no good for you.
So
It's
bad.
poison. And then it's like there are food pyramids upside down. The grains, no. The only people that can eat refined sugar or simple carbs are endurance athletes. And 99.997% of us aren't endurance athletes because
Nope.
that stuff just gets immediately stored as fat because our motor's not going fast enough to use it as fuel. Those are the only people that can do that. That's number one. Take vitamin D. If you're below, if you're above like the middle of America, north, you have to supplement with vitamin D,
Yeah.
5,000 units a day. That's the other deficiency I see, the major one in the lab stuff. As far as practice stuff, I'm a one man show here. I'm a terrible boss, so I decided I'd do everything by myself several years ago, which is fine. My boss is crazy, but that's beside the point. Um, you can't be afraid to tell people what you think is correct for them because they're going to go to Dr. Google first, and you can't be afraid to. I don't want to use the word call them out, but sometimes you have to.
But we're looking at you.
Right, right. You can't
Yeah.
be like, okay, you read that somewhere in some search engine, right? And it's just funny to me that people think they know more than I do about things, right? I go, how many medical degrees do you have? Zero. Okay, anyway. So that's you can't be afraid to just sit them down and say, look. And if they go for it, great. If they don't, no, that's fine. Let them go and find their way. It's fine.
Yeah.
But sometimes you just have to do that.
I agree. Nothing, I think the best policy is one, honesty, but there's also being direct too, very direct and saying, hey, and it can be controversial. Like this isn't the way for you, and I'm not going to do it.
Right.
And so, but that puts the person first. You can
100%.
easily say, yeah, we're going to do all these things. You're going to spend all this money here. But that's only serving your wallet, and that may not be serving the person in the way they need to be served. So
Right.
I agree with you. I love all the pro tips in terms of health. Yeah, I mean, people think of, chiropractic aches, pains, but I feel like no one talks nearly enough about our diet in America and, all the things that we should be doing, we should be thinking about get rid of all the fads and what's happening and go with the basics. So we need to get back to basics here.
Yeah, it's really not that complicated.
Mhm.
And I don't want to name any specific things, but newest one is these weight loss medications everybody's taking,
Yeah, the
and
GLP.
they're not cheap, first and foremost.
Yeah.
And so if you follow the pattern in America, it's this new drug technology comes out, and then 3 or 4 years later, the class action lawyers get a hold of it, and then that goes away, and then the next one comes, and then 3 or 4 years later, the class action lawyers get. So it's like it's a self feeding, right?
Yeah.
And one of my other best buddies is a lawyer, so I give him you know guff about it all the time. But
It's
um,
constant
but it's
healthcare
going to
whack.
happen. It's going to happen. Give it another
Yeah.
couple of years, and it'll happen.
It's
Uh,
healthcare whack-a-mole. That's what
yes,
we're doing
exactly.
here.
That's great. I'm stealing that one.
Yeah,
I'm writing
you
that
you
down.
steal it. You have my permission. It's recorded.
Perfect.
Uh,
Healthcare
but
waggle.
But yeah, I mean, yeah, there's constantly things popping up, being knocked down, and something else comes back up. And so it's really important to, this is exactly why we're doing this. This is exactly why we're interviewing great people like yourselves, because we want the right kind of information out there for not only, patients, but practitioners and, support the private practice field and, to bolster these people up and to get the right information out there. So one, really appreciate you coming on here today. And to kind of end things out, would love for you to tell us where people can reach out, where they can find you, so they can touch base and ask you some more questions if they'd like.
Cool. I'm in just outside of St. Louis proper. My website is www. Do you have to say that anymore? I don't know. I'm out of tune, but SoftWave Mo, SoftWave Missouri.com. 314-842-8884. That'll get you to where you need. And if you're one of those people that calls and doesn't like to leave a message, I probably won't call you back. That's what I'm trying to figure out right now. Because there's a section of people that don't like to do that. I don't understand. But yeah, no, you can go to that website, softwavemo.com, and learn about the SoftWave and some of the other stuff that I do here. I'm a small town boy from 750 people town in Illinois, and I have a little small office here, and I don't need all the glitz and glam and the overhead. No, I did all that for a while, and it wasn't any fun. So I'm having a great time now. With the SoftWave and the clinical nutrition stuff, and nice people like you reaching out, I have a good time. It's fun.
This is what makes the world go round, right? I love it.
Wonderful.
Well, Dr. Toby, this has been awesome. Thanks so much for joining on today, and we hope to have you again.
Thank you so much, Rich. I appreciate it.